This next case reviews treatment of a mycotic cerebral aneurysm treated with a liquid embolic agent, specifically NBCA. Here, a 60-year-old female who initially presented with a ruptured pericallosal artery aneurysm that was treated endovascularly comes in with a postoperative CT scan demonstrating new intraventricular hemorrhage and intracerebral hemorrhage. The CT angiogram shows a de novo distal left MCA aneurysm believed to be a mycotic aneurysm. Here's a CT scan and the CT angiogram showing the distal mycotic aneurysm. This mycotic aneurysm is seen filling off of the middle cerebral artery. Here we can see that there's filling of this mycotic distal MCA aneurysm. We also see the coil mass from a previously coiled aneurysm as described earlier. On this view, we see the microwire and microcatheter being brought up into the distal middle cerebral artery. We're advancing the microcatheter over the microwire. A run here demonstrates the branch off of which the mycotic aneurysm occurs. We continue to navigate the microwire and microcatheter in the distal MCA. Here we can see the tortuosity of the vasculature in the MCA candelabra, and great care must be taken to follow these vessels and follow the curves of these vessels to avoid a perforation. A microcatheter injection shows that we are in the correct territory, and once again we see the mycotic aneurysm. Now we will attempt to get even closer to this mycotic aneurysm by bringing the microwire and microcatheter up distally using a J configuration of the wire. Here we can see that we brought the wire very close to the origin of the mycotic aneurysm. Now we will begin to track the microcatheter over the wire using push-pull techniques, often shutting the flush off to get the catheter into the distal M4 region. At this point, we're going to perform WADA testing to make sure that if we do embolize this territory, we do not create any neurologic deficit. Once we've WADA tested the patient and they pass the WADA test, we prep the microcatheter by injecting dextrose to clear any blood product. And once the microcatheter is prepped with at least 3 syringes of D5W, we now bring in the NBCA. Here we can see NBCA coming out of the tip of the microcatheter into the territory of the mycotic aneurysm. Here we can see the mycotic aneurysm filling beautifully with NBCA. And catheter runs through the guide demonstrate no more filling of the mycotic aneurysm.